The following tutorial will show you what to expect when the nurse changes your catheter dressing. The nurse will come to your home at least once a week to perform this sterile procedure. This tutorial includes the following sections: effective preparation, removing the old dressing, and applying the new dressing. The skin surrounding your catheter's exit site must be kept clean at all times. For infection prevention, it is important that your catheter dressing is changed on a routine basis. The catheter dressing is usually changed once a week or more often if the dressing becomes loose or soiled. First, you should prepare a workspace which has been cleaned with soap and water, such as a tabletop or a metal or plastic tray. Your nurse will help you decide on a good work surface area. Next, you need to wash your hands thoroughly with soap and water for at least 20 seconds. Rinse your hands to remove all the soap and dry them with a clean paper towel. After drying your hands, use the same towel to turn the faucet off. Next, you should gather the supplies that you will be using. The prepackaged sterile dressing kit contains most of the items needed to change the dressing on the catheter. Your clinician will tell you if you need to gather additional supplies for your dressing, or if a special dressing is needed. These items need to be added to the dressing change kit once it is opened or placed onto the sterile drape before you put on sterile gloves. The injection cap and any add-on extension sets are changed during the weekly dressing change. The first thing you should do is put on clean, non-sterile gloves to remove the old dressing. Remove any anchor tapes from the dressing. Next, carefully peel off and remove the old dressing. Be careful not to pull on the catheter. You may want to try a stretch and peel technique to help remove the dressing more easily. Do not touch the catheter exit site with your hands when taking off the old dressing, and never use scissors to remove tape or the dressing. Before you clean the site, remove any securement devices such as steri strips or the stat lock. If you have a stat lock, stabilize the catheter and gently open the plastic tabs. Carefully remove the catheter from the stat lock. Use an alcohol swab to lift the corner edge of the stat lock pad. Continue to move the alcohol swab under the surface of the pad to dissolve the anchor pad away from the skin. You may want to use several alcohol swabs to help assist with the removal process. Do not pull or use force to remove the stat lock. Remove your non-sterile gloves and discard as directed. Next, you should inspect the catheter site for any signs or symptoms of complications. Look closely at the area around the catheter exit site for signs of infection. Signs and symptoms of infection include redness, irritation, increased soreness or drainage at or around the exit site, and fevers. Call your nurse or pharmacist immediately if you have any of these signs or symptoms. Next, you will open the sterile dressing change kit. Peel back the paper covering of the dressing kit. Be sure to keep the contents in the plastic portion of the kit. Remove the bundled items from the kit, which are hand sanitizer, mask, and sterile gloves, and should be the first few items that you will see in the kit. Open the bundle. There will be hand sanitizer, a mask, and sterile gloves. Open the package of hand sanitizer. Squeeze the entire contents into the palm of your hand. Place your hands together and rub vigorously, making sure that all areas of your fingers and hands are covered. Continue rubbing until the hand sanitizer is completely absorbed and your hands are dry. Next, you should put on the mask at this time by looping the elastic around your ears. The sterile drape can be used as a place to put sterile supplies or as a protective barrier. Remove the sterile drape from the kit by grabbing it at the corner, being careful not to touch any of the items in the kit. Open the drape by only touching it on the corners and lay it on a clean surface, shiny side facing down. This is now your sterile field that is used as a place to put the sterile supplies from the dressing change kit. The sterile drape may also be used as a barrier. If you choose to do this, lay the sterile drape down under the patient's arm, shiny side facing down. The sterile field is now the dressing change tray. Take out the package with the gloves and open it. Carefully pick up one of the sterile gloves from the inside of its cuff and slide your other hand into it. Be careful not to touch the outside of the glove. Pick up the other glove by the fingers of your gloved hand under the cuff. Slide your hand into the glove, being careful to touch only the sterile outside of the glove with your other sterile gloved hand. Once your sterile gloves are on, remove the supplies in the kit and place them on a sterile field drape to set up for your dressing change. You are now ready to clean the catheter site using the swab sticks provided in the dressing change kit. The kit will contain a single alcohol swab stick that may be used to clean the site prior to disinfecting it with the 3 ChloraPrep swab sticks. Clean around the exit site with the alcohol swab stick prior to disinfecting it with the ChloraPrep. Do not use the alcohol swab stick after you have applied the ChloraPrep. Next, you need to clean or disinfect the catheter site with the ChloraPrep swab sticks. There are 3 swab sticks in the package. To open the package, tear the pouch at the notch and pull off to expose the ends of the swab sticks. Do not touch the foam when removing the swab sticks from the pouch. Place the foam flat side down on the area to be cleaned. Apply to the catheter site about 4 inches around the site using gentle friction with back and forth strokes. The total application time for all 3 swab sticks is approximately 30 seconds, or about 10 seconds for each swab stick. Repeat these steps using the second swab stick. Repeat again using the third swab stick. Allow the area to dry completely, approximately 1 minute. Do not fan, blot, or wipe away. Your nurse may choose to use the skin prep provided in the dressing change kit. It is used to help the transparent dressing adhere better or to protect the skin if there is sensitivity to tapes. The nurse will apply the skin prep to the area around the catheter site where the dressing will be placed, but not directly on the exit site or the catheter. If you are using a securement device like StatLock, the nurse will apply that next. The nurse will place the StatLock anchor pad so the arrows point towards the insertion site. Place the catheter wing holes over one post, then slide the device to capture the second hole on the opposite post. Close the plastic covers to hold the catheter wing in place. Peel away the paper backing from the device anchor pad, one side at a time, and place onto the skin. The transparent dressing will now be applied to protect the catheter exit site. Remove the paper backing from the sticky side of the transparent dressing. Place the sticky side down over the catheter exit site. Try to center the dressing over the catheter site. Gently press the dressing down on the skin as you remove the paper from the top of the dressing. Next, apply the anchor tape under the catheter near the bottom edge of the dressing to secure it in place. The last step is to secure the catheter with tape because it prevents it from pulling or stretching, which could damage the catheter. If your catheter is long enough, you may want to loosely loop the external catheter tubing and secure it in place. For most catheter types, your injection cap and extension sets, if you use any, will be changed during the weekly dressing change. If you have an implanted port, your port needle will be changed weekly by the nurse when the dressing is changed. You should be careful not to get the catheter wet. Your nurse will show you how to protect your catheter when you shower or bathe. If your catheter does become wet, loose, or soiled, you should contact your nurse or pharmacist immediately. We hope that you have found this tutorial to be helpful. If you have further questions about changing your central line dressing using a sterile technique, please contact your local Coram representative at any time.